Before we get into the bulk of our interview, I just wonder if I can ask you, given World Mental Health Day is tomorrow, we often forget that politicians are human beings too. How's it been for you?
It's been 19-hour days, 7 days a week, not just for me, for my officials across the department. We've been operationalising many of the schemes that the Chancellor has announced, the bounce-back loans, the coronavirus business interruption loans, the Future Fund. So it's been full on, obviously getting the different guidelines for businesses into place as well. But I think it's equally the same for everyone else, the front line, the NHS, care workers. So this is, the whole country has come together. It's a tough time.
I mean, certainly, your business is kind of like mine, can be quite macho at times. I don't know whether you feel the same as me, but it certainly feels like we can all talk about it rather more than we were able to just a few years ago.
I think so. And I think, actually, there's been a step change. I've been in Parliament for 10 years, and a few years ago, many of my colleagues, Charles Walker being one, stood up very bravely in Parliament. Deena Davison, one of the new intake, a few weeks ago, did the same thing and just talked about it. And I think, actually, that is part of sort of the first step of being able to deal with this. And of course, we've put more money into mental health services in NHS as well. I think it's about 13 billion now, and will continue to increase in the years to come as well.
Well, let's talk very specifically about COVID. We understand that there may well be some changes coming. I mean, just how bad are things in the north at the moment?
It's pretty difficult. If you take last Thursday, I'm going to give you national numbers in the north as well.
Sure.
Last Thursday, infections were just shy of 7,000. This Thursday, just gone, it was 17,000. So that jump in 7 days from just shy of 17,000 just puts it, I hope, in some perspective for your audience as to where we are at. In the north, in cities like Liverpool, Manchester, Newcastle, we're sort of touching about 500 infections per 100,000 population. So it's pretty difficult. Chris Whitty shared some charts yesterday with MPs from the north, just to demonstrate how difficult the situation is.
Indeed, and I want to get into the specifics of that in just a second. But just in terms of what is going to change, I mean, we heard from Gillian Keegan, your ministerial colleague, last night that coronavirus is getting out of control. Your comments chime with that. So what is going to change? What will the north of England look like this time next week in terms of restrictions?
Well, one, obviously, we keep these things under review daily. It's a fast-moving situation. We discuss this with the public health local teams to make sure that we're doing the right thing, and then make those decisions. So you've seen the decisions up to date. Then we can go further to try and suppress the virus more. What I won't do is to speculate about what happens in the coming days, but certainly we're keeping an eye on all of the areas as we deal with the infections.
I suppose the point that many people will be shouting at the screen at the moment, if, as Gillian Keegan says, things are out of control, if it's Nadine Dorris, who's an interest in medical matters, of course, saying that we are at hospital admissions could be reaching a critical stage in the next few days, why are we not acting now?
Well, we are. I mean, this is the whole thing. With local leadership teams, we've acted in terms of social interaction in the home. We've acted in terms of the 10 p.m. curfew and, of course, table service only in restaurants and cafes and bars. And as I said, we keep all these things under review, and I think it would only be correct that the Health Secretary presents this, if we are going to go further, to Parliament in the usual way, and, of course, to you and your colleagues in the media.
Well, who on earth then is talking to the newspapers? Take a look at any of them today. They have clearly been briefed by people working in government, perhaps not in elected office, but they've been briefed by people working in government. I mean, the Speaker of the House of Commons said it's atrocious, frankly, that we are having to find out what the government's strategy coming up is, by sitting down and watching the Sky News paper review at night. What is going on and why won't you get to grips with this?
Well, I think you will agree with me that these leaks are completely counterproductive. Whoever's leaking this stuff is doing a disservice to the service. You asked me earlier about what's happening on the front line.
Yeah.
You're doing a disservice to the service by speculation and leaks. I think that's wrong. I think the right thing to do is wait for the decisions that the government will always attempt to make sure that we do in a coordinated way with the local teams. We
But you're honestly sitting here and telling me this morning that all of the briefing that is taking place is happening without any ministerial oversight, that no minister has instructed their staff to put this stuff out there, because it's farcical.
I can promise you that this minister or no minister would actually instruct any member of staff to go out and actually brief this stuff out.
Are we going to have
These
a leak
are terrible
inquiry?
leaks.
It would be the biggest leak inquiry in the history of Whitehall.
Well, and rightly so, in the sense that this is really bad that people are leaking this stuff. And I hope that whoever's doing this will stop, because actually it's counterproductive, it's confusing, and it's corrosive.
The problem is this, you can accuse the First Minister of Scotland, Nicola Sturgeon, of many things. One of them cannot be inaction. She has moved forward on making sure that the hospitality sector is being restricted in a manner that she feels will halt, or slow the spread of COVID-19. You guys are working with the same data sets. Why are we not doing it at the same time?
Well, first of all, there is a lot of coordination. So there's a lot that is in common between us than what sort of separates us on the interventions we're making. Of course, the scientific advice is devolved at Scotland, Wales and Northern Ireland, and therefore they make their own decisions, rightly so, in coordination wherever possible.
Sure, but
the Scottish
government has acted.
Yes, and so have we.
So 16 days of these restrictions, which means 3 weekends, where people will not be heading to the pubs and restaurants and potentially spreading COVID. We are told, or we are reading in the newspapers, that we're not going to take any action until Monday. Why are we not acting now?
Well, we are acting. So
not in terms of the hospitality sector.
Well, we are. We're table service only, other than in takeaways. 10 o'clock curfew in England and Wales. Northern Ireland have stayed at 11 o'clock. We review all of our interventions and we look at the data. Chris Whitty shared the data with Northern MPs yesterday. You can see where the spike's taking place, which demographic, where it's coming from. So hospitality is about 30% of the infection rate.
So there's real evidence now, isn't there, that the hospitality sector is a major contributor to the spread of COVID, isn't it?
Well, hence why we took the action of table service only and restricting the time to 10 p.m. Curfew. Not something that I certainly took easily, because I think these businesses have tried very hard to be COVID safe. But clearly it's something that we have to do to stop us having to go into a sort of, national lockdown or a much harsher set of interventions.
But given that there is the evidence regarding the hospitality sector at the moment, why did the Chancellor sitting there in that seat earlier this week accuse me of coming to simplistic conclusions when I had the temerity to suggest that perhaps paying people to go to pubs, restaurants and bars, which we are going to be seeing closing down in the north of England at some point next week, that might have contributed to COVID?
Well, first of all, in the summer, the restaurants that participated in which I think what you're referring to, the Eat Out to Help Out scheme, did it in a safe way. They did it in a COVID-safe way, and we didn't see the sort of spikes that we saw much later coming through in September.
And then Chris Whitty speaks to 150 MPs yesterday in a dark room with a slideshow that shows that the hospitality sector is responsible for 30% of it.
So the social interactions within hospitality and in the home is clearly a problem at the moment, which is why we're acting on these things. And I think that's a responsible thing to do, Neil.
Why is it, though, that there has seemed to be, on a number of occasions, a lag factor? We were told at the beginning of all of this that there would be more coordination between the nations. Can you honestly say that, mayors of Greater Manchester are as happy with the way things are going in England as local authority leaders are in Scotland?
Well, I think my job, our job, is to make sure that we work with the local leadership teams, and we do that on a daily basis. Public health local teams have the best knowledge of their locality, hence why we listen to them, hence why we work with them. Now, you're not going to get everything right. Some mayors, Andy Burnham's clearly upset with certain actions. We have to continue to work together. I think in the national interest, we have to set aside politics. It's unfortunate that Keir Starmer and some of his team see it as an opportunity. Never let a good crisis go to waste. I think that's heartbreaking in many ways. I think we've got to continue to work together. My message to all local leaders, no matter what party they belong to, is we have to continue to work together. You're seeing other countries. You just said on your opening piece about France and other countries having to go even further now because the virus is even higher than where we are at the moment. So it is incumbent on all of us to come together and make sure we control this virus.
We're approaching the end of our time together, so I just wanted to slightly change topic and move on to one which we've discussed a number of times on various programmes here, MPs' pay. Once again, we're hearing from the Independent Parliamentary Standards Authority that you're going to get a £3,000 pay rise at a time when people are losing their jobs in their millions. Isn't it about time to ask the question of whether or not IPSA actually is fit for purpose?
Well, an independent body has to be the right way forward, hence why IPSA was set up. It is independent.
Do you think a £3,000 pay rise is appropriate right now?
I don't think a pay rise is appropriate.
Well, then it's not fit for purpose, then, is it?
I've been a minister for now coming on 3 years, and I don't have a ministerial salary, but I think it's a privilege in many ways to serve your country. But nevertheless, I think it's right that it's independent. And they have to also explain themselves because they also exist in the court of public opinion. And so, yes, of course, it's much better than the old system. Before I came into Parliament, it used to be parliamentarians who decided these things.
Under the old system, you guys would not have voted through £3,000 of a pay rise. That's the biggest failure with this system.
As I say, it's independent, but I think it's incumbent on the leadership of IPSA to also explain to the public, because we all exist in the same sort of social fabric of society, and the court of public opinion is important, as to why they think this is the right thing to do.
Would you give it back, donate it to a food bank?
I would certainly look at donating it to one of my very good causes, maybe the Shakespeare Hospice in Stratford.